Today's patient is a very healthy and fit 59-year-old athlete who's had 2 children in the past. However, the patient feels that she has a lot of extra skin, especially in the abdominal area, and she wants to get back to the place where she can feel comfortable in a 2-piece bathing suit. So the patient is here today for a tummy tuck.
So I had my surgery October 8th with Dr. Lee, and it's already been over 2 months, and I love the results. Absolutely fantastic. I'm so overjoyed. The reason I wanted to get a tummy tuck is because in 2020 I have lost a lot of weight. So the last 5 years I've been on an extremely strict diet, no sugar, no carbs for 5 years, no exceptions. And I noticed that everything else looks nice and tight. However, my tummy, because of the weight loss, there was a lot of loose skin, and no matter how many hours I worked a day, the loose skin stayed.
A lot of times when I evaluate a patient for a tummy tuck, I look at multiple components. I look at the amount of skin and fat that they have and also how loose their abdominal muscles may be. Because this patient stayed very fit and active even after having children, she doesn't really need any additional procedures such as liposuction for additional contouring. She just needs excess skin removal and muscle tightening. So she's a perfect candidate for a standalone tummy tuck.
I finally made the decision to come back to Dr. Lee. He's such an amazing, he's an expert. And I knew I was in great hands with him, and sure enough, I decided to do the tummy tuck with him.
With the tummy tuck, I designed the patient's incision as low as possible to stay within her favorite types of clothing and underwear. In order to keep the patient comfortable during her post-op period, I also inject a long-term anesthetic directly into the muscle. This reduces the amount of discomfort and pain meds that the patient will have to take after surgery. And finally, I remove as much extra skin as possible and pull the skin in a direction to accentuate her natural waist. The results after surgery are immediate. The skin is tightened, the belly button is in a better position, and the waist is obviously cinched. Within 1 to 2 weeks, the patients are able to do their daily activities, and they're able to go back to the gym and do regular exercises by 4.
I healed up nicely. I did have minimal pain in the beginning, but after a few days, I would say maybe a week and a half, I was feeling amazing. I had no more pain, and I can move around, and I can already see the results. Actually, the results I could see probably 1 or 2 days after the surgery. He exceeded my expectations. I was just completely surprised.